very good morning. Namaskar. I am Dr. Shweta Mathur from Apollo Hospital, Noida. And today we shall be talking about oral health and nutrition. Oral health and nutrition go hand in hand. I have always said that our smile, our mouth is our gateway to our personality, our first introduction to the external world. So we have to remember to make it the best impression. This can only be achieved by not only having proper cleaning or hygiene maintenance protocol, also by good nutrition, which overall maintains the best health of our teeth and oral tissues. Please remember that oral health and nutrition is a bi-directional movement. Bi-direction means two-way relationship. A relationship where only good teeth will enable you to have good nutrition, and good nutrition will enable us to have good dentition. So this bi-directional movement has to be taken care of and revered. We have to remember that oral diseases include dental caries, periodontal diseases, erosions, certain manifestations in the oral mucosa, which all have an influence upon what we eat in our everyday life. The most common health condition that we deal in the oral mouth is the dental caries. It is the most feared disease worldwide and the most rampant, be it children or the elderly. Dental caries, as the name proceeds or name explains, is used in two ways. It is a progression, it signifies a progression of the disease, and it is also used to denote the cavity or the non-cavity teeth. So the dental caries is basically a dynamic process like our human body. It always is in motion. The only thing that accelerates the motion of the progression of the dental caries procedure or the demineralization procedure is the one that will increase the precedence of the disease or not. So this factor is the nutrition that we supply to our body. Now I shall explain it to you in simple terms. Caries is a procedure that occurs due to the bacteria present in the biofilm that covers our teeth. The action of these bacteria is basically more rampant when the pH of our mouth is low, that is acidic. Now the pH, we have all studied in school, is the acidic content or the alkaline content of a particular reagent or compound. In the same manner, if the pH of our mouth is low, we tend to become more prone to oral diseases. The pH is low when the bacteria is at its highest action. And this bacteria comes in highest action when we provided the sugars or the carbohydrates. Yes, we know the relationship between the sugar and the dental decay, but we do not know that it's not only the consumption of the sugar or the carbohydrate, but it is how much, when, and which that we have to be careful about. The nutrition basically I divide in two sections. One is micro and one is macro. Micro involves vitamins and minerals, and macro involves the dietary things that we consume, the carbohydrates, proteins, and the fats. These carbohydrates are the ones that cause the most damage. So what happens is then carbohydrates, they get decomposed into a single molecule or a two molecule or a multiple molecule carbohydrate. One can be a monosaccharide or a polysaccharide, but the worst carbohydrate to deal with is a polysaccharides like sucrose and fructose, which actually form the base or the foundation for bringing about this debilitation. The moment we have carbohydrates, it brings about lowering of the pH of the mouth and hastening of the action of demineralization. Body being dynamic causes remineralization also. A natural healing occurs parallelly. But this remineralization may not be apt and does not match the kind of demineralization that is happening. And due to this disparity of demineralization and remineralization, a cavity is formed, which if left undetected, we know ends up in a painful situation. So we have to not only understand what to eat, we have to also understand when to eat. Now, why is when important? When is important? Because the maximum action of these sugars or the carbohydrates that we consume occurs in the 30-minute time interval after consuming our food. If we do not rinse, if we do not brush, if we do not take proper hygiene measures in these 30 minutes, then there is no use taking any measure after that. This is so because the highest production of the carbohydrate mediated demineralization happens in these first 30 minutes, or the lowering of the pH is the maximum in these first 30 minutes. So, this is where we attack. If we don't attack at this time, then we have to reduce the carbohydrate content that we are having. Now, having said that, you also have to understand which carbohydrate am I talking about. I just told you added sugars, maybe in a form of a tea or a coffee or food items, and even natural sugars, which may occur in honey also for that matter, or fruit juices, has the same deleterious effect. So do not classify them separately. Sugars in added forms and in content and innate content can have the same deleterious effect. However, certain carbohydrates can be lesser dangerous or karyostatic, or maybe karyostatic is a technical word, but they can be less caries causing. For example, the milk carbohydrate, which is lactose, is lesser in its adversity, or it's an adverse form as compared to the added sugars. It follows the same cycle, but it does to a lesser degree, and it has a buffering mechanism. What is the buffering mechanism? Certain carbohydrates or sugars that we consume can be deleterious, but their deleterious effectiveness is reduced by its calcium content. So the moment there is a calcium content along with the sugar content, the adverse reaction of the sugars get lessened. So this is where yogurt and milk comes into place. Yogurt is highly acidic. It has a pH value of 4, but it has a high calcium buffering mechanism and therefore is not considered a dangerous carbohydrate. So please know what you eat, when you eat, and how you eat. That is the time you can take the maximum benefit from the nutrition. The second disease that comes into play is the periodontal. Now, periodontal is not a common word for everybody to know. When I say periodontal, I mean the gums, the gingiva, the supporting tissue. A lot of studies conducted by the ADA or the IDA, we have been studying and doing a lot of study charts, but we have not been able to link the periodontal or the gum health directly to nutrition. However, we know that a lower pH or the acidic pH also interferes with the healing of the body. So any pre-existing gum disease or gum disorder can have slowed down healing or impaired healing and may cause more problems for the patient. A good, well-rounded, nutritious body fights infections better, fights any immunocompromised condition better. And therefore, these gums, which are actually the first ones to get affected in any immunocompromised disease, fare better. A good nutrition gives me a good supporting tissue. Now, this is where calcium comes into being. Now, calcium is an extremely important element of our diet because it forms the basic mineral of our teeth and our bones, which is the hydroxyapatite crystals. So when the bone health is good, when the nutritional value of calcium that is being consumed by my individual is good, then my periodontal or the gum health will automatically be good. So we have to remember, according to the studies and the research is done, 700 milligrams, please note, 700 milligrams of calcium is recommended to children from 1 to 3 years of age, and approximately 1000 milligrams of calcium for children above 4 to 12. So this is the calcium that is required for a good, well-rounded, nutritious body to maintain good oral health. Calcium forms the basic molecule of the bone and the teeth. Not only these children whom I have been talking about previously, all adult individuals also require a basic set of calcium molecules. Calcium is most important for good bone health of adult females who have given birth and are lactating, because they are the ones who lose a lot of calcium by passing on the milk to their little ones. So here the calcium requirement of the body escalates. If one does not compensate for this nutritional deficiency that can occur during pregnancy and during lactation, it leads to deleterious effects later in the life as far as dental health is concerned. Another most important nutritional element apart from calcium is the vitamin D. Now, vitamin D, without going into the grave biochemistry, I would just like to explain all of you that vitamin D forms a cycle, a network by virtue of which calcium and phosphorus is absorbed into the bones. So, if by any chance vitamin D is missing from our diet, none of these other elements will be incorporated as well. Vitamin D forms the are not such, the environment is not such that we can absorb vitamin D from the natural giver. So we have to supplement the vitamin D from our nutritional dietary habits. We have to remember also that females who are pregnant or are expecting, if they are advised or prescribed vitamin D during their pregnancy, then it reduces the rate or the incidence of dental caries in their children. Yes, studies indicate mothers who have consumed vitamin D during pregnancy have children who have stronger teeth and stronger bones. So, as a protocol, one should ask one's gynecologist, and I'm sure all the gynecologists do prescribe vitamin D during pregnancy as well. Another such element that plays an important role in the good health of the teeth and the bones is also phosphorus, which is, of course, will be supplied only in our dietary habits. So, let me sum it up by saying that good nutrition takes care of your body on the whole. So, when if the nutrition is good, my dentition, my oral tissues will be good and strong. And the vice versa is true that if I don't have good teeth only, how will I chew? How will I provide my body with a good nutrition? So, teeth, bone health is directly a bidirectional force for the basic nutrition of the body. Another disorder that we do see in the teeth, which can be related to deficiencies of nutrition, is the erosions. What are erosions? First, we have to understand that. A lot of my patients have dental erosions. Erosions means where the enamel is worn off, it is scaled off, it is leached away. What causes it? What causes is bad or junk food consumption, which has zero nutritive value, namely the carbonated drinks, certain high acidic content food, high carbohydrate, which later on leads to a lower pH value, as I've already explained to you. All these things result in eroding away of the enamel. Now, when the enamel is eroded, please remember, nobody in the world can replace the enamel. They can cover your tooth, but nobody can replace the enamel. Enamel once lost is lost forever. These dental erosions occur due to the carbonated action, the low pH, highly acidic action of certain drinks like the cold drinks, I don't want to name them, caffeine, high caffeine drinks, certain citrus fruit families not taken in quantity. When I say citrus fruit families, I'm talking about lemons, I'm talking about oranges, I'm talking about mosmis, I'm talking about kinus, I'm talking about avlas. I include a lot of fruits in this family whose overconsumption causes abrasions on the enamel which cannot be repaired. So all these foods, though may appear to be nice and friendly, when they are taken in a higher dose, can prove harmful. It also involves vitamin C tablets. Some people can start consuming these tablets as a habit. There also it can cause trouble. So please be cautious of having food and having the food in the right dosage. Another disease that we encounter due to certain nutritional imbalances in our body are the aphthous ulcers or the recurrent aphthous stomatitis, as we call it, the RAS. Now, this occurs mainly due to certain nutritional deficiencies which occur in our body in the form of deficiency of zinc, molybdenum, selenium, certain antioxidants, lycopenes, fluoroquinones. Now, these names may sound alien to you, but you may be surprised to understand that all these things can be found in apt quantities in the normal food that we take in our day to day life. However, some people have altered diets, certain food restrictions, and may not be able to consume. This is the time when they should consult the physician or the dentist and have a prescribed dosage of these micronutrients, as I call them, the zinc, the selenium, the molybdenum. All these are very important to maintain the integrity and the sanctity of my oral tissues. Certain white patches, leukoplakic patches as we call, make a prominent presence on these oral mucosal tissues due to certain of these deficiencies. A lot of these deficiencies, a lot of these diseases are cured by giving these micronutrients as medicines. So it is very important to not fall into this trap and consume these micronutrients in their natural form by consuming good high fiber green leafy vegetables, having nuts, cranberries, apple, and milk products in your regular diet. Another most important thing that you have to remember that not only are these all elements important, it's also important when you have. Now, this is the point where I will end my conversation with, and I kept it for the end. Sugar is not prohibited. Carbohydrates are we're not asking you to stop having them. We're asking them to have it in the right quantity at the right time. Now, what am I talking about? I'm trying to tell you that you have your carbohydrates, have your rotis, have your rice, have your sugars, but within that period, 30-minute time period, which I had talked about earlier in my conversation, if we keep on having carbohydrates or sugars throughout the day, then that 30-minute time of danger is extended throughout the time duration, throughout the day. So, what we are doing is basically exposing our teeth to the deleterious effect of the sugars and the carbohydrate throughout throughout the day, and rather than only 30 minutes. Therefore, we are exposing our teeth to more demineralization. So, the habit of continuously chewing food, sugar, candies, putting something in my mouth throughout the day just for the heck of it is not the right thing to do. Have a balanced diet at the right time in the right way and lead to a nutritious mouth.